So even though there are guidelines about giving surgery to older women who've got early breast cancer, if you look at the statistics, you find that the rates of surgery decrease with age, particularly over the age of 80. And a previous Cochrane meta-analysis didn't find a significant difference in survival between giving immediate surgery or waiting until local progression occurs to give surgery. Of 3 randomized trials of immediate versus deferred surgery using updated follow-up data from these 3 trials in just over 1,000 women. Okay, so in order to answer the question, we've acquired individual patient data, so data from every woman in 3 randomized trials that were run of immediate versus deferred surgery. And these are trials of immediate surgery with tamoxifen or just tamoxifen, and then surgery in the case of local recurrence or progression. So as expected, there is very good improvement with surgery in local control, so that the local recurrence or progression rate is reduced by about 3/4, and that benefit becomes apparent immediately. The big question is whether that benefit on local control extends to breast cancer mortality, distant recurrence, and indeed overall survival. And what we've found is that there is a smaller but still highly significant improvement in distant recurrence rates with immediate surgery, and that this translates to a similar reduction of about 1/3 in deaths from breast cancer and a significant benefit on overall survival as well. But that benefit only becomes apparent after a few years of follow-up. There seems to be little effect on distant recurrence in the first 2 years after surgery. I think there are 2 important takeaways from this study. The first one is that immediate surgery does not just give improved local control, but that it reduces the rates of distant recurrence and it reduces deaths from breast cancer. And the results of the updated analyses of the NSABP B06 study will be important as well to contextualize these results. The second important finding is about how we run trials of differences in local control or screening. What it shows is that even when you've got a very big difference like surgery versus no surgery, the differences in breast cancer mortality don't appear immediately. So if we're looking at lesser differences, we again will need to have sufficient patients and sufficiently long follow-up to be able to give reliable results.